Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics. I'm Stephanie Talea with Practical Dermatology magazine. 4-year data from the Phase 3 Checkmate 067 clinical trial, the longest follow-up to date, continue to demonstrate durable long-term survival benefits with the first-line combination of Opdivo, nivolumab, and Yervoy, ipilimumab, versus Yervoy alone, in patients with advanced melanoma. Bristol-Myers Squibb recently reported the data, which showed for a minimum follow-up of 48 months, 4-year overall survival rates were 53% for the Opdivo plus Yervoy combination, 46% for Opdivo alone, and 30% for Yervoy alone. Additionally, the percentage of patients experiencing a complete response has continued to increase, with complete response rates of 21% for Opdivo plus Yervoy, 18% for Opdivo alone, and 5% for Yervoy alone. In addition, results of an analysis of patients who were alive at the time of the 4-year analysis showed that a higher proportion of patients were treatment-free, off-study treatment and free of systemic subsequent therapy, in the combination group at 71%, compared with monotherapy groups at 50% for Opdivo and 39% for Yervoy. The safety profile for Opdivo plus Yervoy in Checkmate 067 at 4 years was consistent with prior findings, with no new safety signals and no additional treatment-related deaths. Data from Checkmate 067 will be featured in an oral presentation at the European Society for Medical Oncology 2018 Congress in Munich, with simultaneous publication in the Lancet Oncology. Medical Education Consortium Ex Medica LLC of Atlanta has developed a new educational initiative, the use of energy-based devices for improving sexual health. The overriding goal of this unique conference is to present factual data in a CME setting to address this new arena for practitioners and to assemble a faculty of experts across specialties. According to meeting chair, board-certified dermatologist and director of skin laser specialists of New York and New Jersey, Dr. David J. Goldberg, we recognize that there was a void in the market for an educational conference in this evolving area of aesthetic medicine. This program brings together experts across multiple specialties, including dermatology, gynecology, urogynecology, plastic surgery, urology, and internal medicine, to present a balanced overview of the optimal treatments and hands-on training on how to implement these procedures safely into a practice. The program will open with a review of the diverse energy modalities that have evolved as effective treatment options for the most common conditions of concern to patients, including stress and urge urinary incontinence, atrophic vaginitis, dryness, and erectile dysfunction. Attendees will have the opportunity to review the literature in the key areas of radiofrequency, CO2 and erbium lasers, low-intensity ESWT, high-FEM, PRP, and other modalities. According to Wendy Lewis, President, Wendy Lewis & Company Limited, Global Aesthetic Consultancy, there is also a need for practitioners to understand how to effectively incorporate these modalities into their practice in the most sensitive way. Attention will be given to the patient consultation and tips for starting the conversation on sexual health and wellness treatments. This innovative conference is open to physicians of all specialties, including dermatologists, gynecologists, urologists, plastic surgeons, cosmetic doctors, as well as physician extenders and practice staff. 8 hours of CME are available. To register, visit events.x-medica.com/step. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Ortho Dermatologics.